during this journey? You ain't kidding.
They've got a big cleanup job to do. Heavy rains, a flooded creek, and visions of patients left stranded during Hurricane Katrina prompted the hospital CEO to order an evacuation of every single patient Saturday night.
Initially, when I received the phone call that we had water coming in over the banks of the Haw Creek, the short time in which it took me to finish my trip to the hospital, the water had actually started to encroach up into our patient visitor parking lots. And you know, we talk about disaster planning a lot, and that it certainly is a priority. This certainly brought it home to us that evening of how important it really is. No idea the water was going to continue to rise to the extent it did. Somebody ran out of the boardroom, had gone to the stairwell in our east building and opened the door, and the water was one step away from being on the ground level of the hospital. That's when I knew we were in really big trouble.
When the loading dock doors failed, but it was probably a wall of water coming through the basement at that time, and I think that would have been devastating. When I arrived on site, you know, there was school buses were there, you know, the ambulances had arrived. Clearly we were in a full-scale evacuation. In the way you get any given patient down, you know, you needed 4 to 6 people to help carry the person, and then, you know, at least a couple others with flashlights and to help with doors and things on the way down. So they were just sort of carried down in that fashion. Once the patients were down and out of the building, there was a sidewalk there outside, and the patients were just kind of lined up there. Patients were, you know, sitting on stretchers or sitting in wheelchairs, kind of holding their charts. The ambulance would kind of pull up through the water and get to the sidewalk, and so you're loading the patients into the ambulance and they're driving off. As we convinced ourselves the last patients, you know, were gone, we realized that we quickly had to kind of change our mindset from safely evacuating patients to securing the site. We went basically top to bottom twice, just room to room, would mark rooms with an X on the door and could assure that there was no one there. I can remember just kind of walking into the building then that night about 3 a.m. or 4 a.m. You would just kind of eerily hear like a monitor beeping like down a hallway, and then you'd hear another sort of beep, you know, a lonesome sort of tone down another hallway. And I can remember thinking that the batteries were probably running down, you know, in the monitoring equipment. It was this kind of the sound of a dying building.
But I think it really hit us when we were able to get into the basement, and that was about 2 days later after we had pumped all the water out of the basement. We were able to go downstairs for the first time, and that was the shocker. That's where you walk down the stairs, in some cases couldn't get through the doorways because so much furniture, equipment, other things had been swept by the force of the water and were totally blocking different doorways, so you couldn't go through there. And then actually walking, and when you finally could get through, walking through some of the hallways and just looking at the extent of the damage, it was oh my God, you know, we have a lot of work to do here. The imagery in the parking lot the first couple of months was really astounding. You know, it was transformed to, it looked like, you know, some kind of war zone where we had piles and piles, and it was literally piles of rubble that had been pulled from the building, piles of equipment that was twisted and muddy, cars that had been wrecked by the flood that hadn't yet been towed out. You know, we were really concerned about our employees and also about our physicians, and then the patients and community. So as we announced that we would be paying all of our employees' salaries at least for the next 3 months, it was like a wave of relief. One of the unanticipated bonuses for the community in all of this was that we had to find meaningful work. We had some employees that could staff other hospitals where our physicians and patients were going, and we had some employees that needed to do their regular work. We had some employees that we needed to help with the cleanup, and then we still had kind of some extra employees, and we realized the community need at that point was great. All along we had been most worried about not being able to provide emergency services in the community. So when Med1 called us and told us they were on the road, we were tracking their progress. We were thrilled to have them here. But when Med1 was leaving, we wanted to send them off with a great send-off. And as they pulled across the bridge, both sides of the bridge were lined with employees, just clapping and cheering. And at one point, Tom Blackwell, who is the medical chief of the Med1 operation, and so he stopped the truck in the middle of the bridge, jumped out of the truck and ran up to give Jim a giant hug, and then climbed back into the truck and pulled out. That was a wonderful moment for all of us. This whole period has been about a lot of highs and a lot of lows.
The flood-damaged Columbus Regional Hospital hopes to reopen by the end of October. But today officials announced the hospital has leaped a major hurdle.
2 months after a devastating flood, Columbus Regional Hospital's emergency room has reopened in the main hospital building.
This is our triage area. We can triage 2 patients at one time.
$2 million were raised to reopen the ER. Interim or not, Columbus Regional employees are glad to be back in the main hospital.
It's fun, it's nice, everybody's glad to be back. We're glad that we can serve the public, and this hospital has just been great to everybody. Columbus Regional Hospital was damaged to the tune of $180 million by the flood. 1,800 employees were made a promise that has been kept. I was off of work for a month because my house was flooded, and I got paid every week anyway. The mobile ER from North Carolina pulled out of Columbus Regional this morning amid a standing ovation from the hospital staff.
Med1 and Columbus Regional Hospital had an immediate bond when they arrived on campus. And to see them leave was sort of bittersweet in many ways, because they felt like family and they had brought such a needed service to the community. But it was at the same time great that we were back in the facility. It was the first step in getting the facility back up and running, a sense of normalcy, if you will, to providing patient care. And I don't think that we'll get back to the way it was. I don't think there's any way we can. This flood has had such an impact on everybody involved in this organization. I don't think there's any way it can't have changed things going forward. We will recover from this, and we're going to do it, and we're going to set the bar on how hospitals recover from such a disastrous situation, and we have. How proud I am of each and every one of our employees for sticking through this with us and together, the teamwork, the attitudes, and so really it's a thank you, and just to let them know how proud I am of this organization. We are Columbus Regional Hospital. It is the people within the facility that make Columbus Regional Hospital what it is and what makes it such a great organization. And our employees have really just, gone above and beyond to demonstrate that pride and that slogan that we are Columbus Regional Hospital.